Hey, today we're going to talk about a farmer friend of mine who came to see me with chronic L5S1 facet issue, causing nerve root radiation down one leg. Great guy, farmer, right? They work, they work, they work. I sometimes feel like their leg could be dropping off, but they would keep working, and they somehow don't seem to feel pain like most people. And I think they're a great example of, particularly if they love what they're doing, they have a goal, they have a mission for the day, they have stock or animals waiting for them, and they're very clear on what their day looks like, and they get up and they do it. But what I notice in these guys is that their bodies probably send them lots of signals that they do not tune into. There were plenty of warning signs building, but they just somehow, it doesn't register until it's a raging problem. And it's almost like the body in these guys or gals has to amplify to a high level to get them to stop. And that's what this guy was about. He was in high level sciatic pain raging down his leg. And it was coming from, imaging showed it was coming from an L5S1 nerve root problem. He'd had steroid injections, um, he'd had dry needling, he'd had muscle work, um, he'd had, what else had he tried? Acupuncture. Um, yeah, so he was really trying. He wasn't resting, but he was trying. Anyway, so we had a chat. I encouraged him to understand what pain was, that it was an invitation from his body that something he was doing was not serving him. And I guess I tried to ask him to pin a few movements that he knew were not feeling great, but that he kept doing anyway. Which even that, I mean, from where I sit in my philosophy of life, I just have to shake my head. If my body sends me a signal of pain, I respond, I try and figure it out. I simply don't keep putting my finger in the electric socket and then complaining that it hurts. But this is what a lot of people do. They're doing the same movement in the same way and it's giving the same pain, and somehow they're thinking that's abnormal. Whereas to me, that's like really normal and consistent. Anyway, I digress. I knew this guy wasn't going to stop. He's a farmer. He's not going to stop and rest. I can't fight who the person is. My only window was to perhaps look at the things that were causing him the most pain and to see if we could find another way to do the movement so that it wasn't stressing his L5S1 zone. That was where I went to. He wasn't going to do emotional work. He's a farmer. It's not going to happen. As much as I would want it to. It's not going to happen. So we were going from a movement perspective, and that's okay. So I was able to get him to buy into the concept that if he's not going to rest and that his body's hurting, if he wants to stay in the game, he's going to have to learn some new tricks. He's going to have to learn to move smarter, not harder. So I looked at his body, and thankfully, it was very straightforward. When he was standing, I will see if you can see my pelvis from here. When he was standing, not sure you can see my feet. It's really important you see my feet. His right foot was turned out. His left foot was forward of his right foot. And that was creating a pelvis. I'm just gonna move the screen up a bit now. That was creating a pelvis that was facing to the right. Yeah? Combined with that, he had a slight shift over onto his right side, his right foot, which means there was a nice upthrust of his femur into the hip, causing more compression in this side of his back, less compression on this side. But when you combine that with the twist of the pelvis, then it was very obvious that his facet space on the right had to be very closed. We have a little exit canal like that where our nerves come out. the intervertebral foramen in our spine. That's even big, I'm being generous. They're quite small. And we are asking a nerve to slide in and out of that foramen every time we move. Now, if we have a skeletal structure that's not centered and balanced, you will find in your facet joints, whenever there's a rotational bias of a vertebrae, if your pelvis is facing right, your vertebrae are normally facing right too, unless the rib cage is twisted back left to compensate, and then we get this extra torsion through the lower lumbar vertebrae, depending on what's happening on top. But in this guy, he was basically closing down his right exit canal for that nerve root through the way he had organized his body in space. So the aim of a steroid injection around the nerve root is to take the swelling out of the nerve root. But the very fact you have a nerve root compression is an invitation that you probably have a mechanical structural alteration of your organization of your body in space. And to treat the inflammation without addressing why there's a narrower space is kind of like missing the point in my mind. So thankfully, I could look at this guy and I could see it. And I then helped him to look at possibly playing with the idea of stepping his left foot back because it was forward. Whenever we have one foot slightly forward of the other, we're immediately in a rotated pelvis. Step that foot back, bring this foot so that the toes pointed forward, and if anything, to step the right foot forward a little bit so that now that he was in a degree of left rotation with his pelvis. I didn't worry too much about the shift because I just thought for this guy, one thing at a time was probably more likely to be played with than too many things. We re-altered his foot positions in his pelvic position, right foot in front of left, right toes turned in instead of turned out, those two things. And then I re-asked him to do the tasks that were causing him discomfort. They felt better. Not great, not 100% better, but markedly improved. When we then added the shift, we got better. At which case he was like, all right, so if I do this and I do that and do that, then I possibly can keep doing what I'm doing. Very much possibly. I think the advantage for someone like an active person on their feet is that he was going to keep moving, but at least if I could get him to move now from a new position, then he was doing his own therapy. He was teaching his pelvis to work from a left rotation rather than a right. He was teaching his left foot to load, decompressing the right side. He was doing the therapy to unwind all of the mechanics, all of the tension, all of the muscle imbalances by doing what he does every day, just doing it well, not in a poor way. And so for this guy, it was the ticket. It worked. He was shocked. I was a little bit shocked that it worked so well. But I often find in someone who's happy in life, he loved the farm, he loved doing what he was doing, it was his thing. Then there was nothing else blocking his healing. His body wanted to allow him to keep going. It couldn't keep going in the arrangement and the alignment that he had. Now I could go deeper, and I did, thinking to myself, why was that guy's foot turned out? Why had he adopted that pattern? And honestly, I think if I had looked at his eyes and his ear inputs, I would have got my answers. But I don't think he was about to do any retraining of his eyes or his ears. I think I was very lucky to get him to invest in the alteration of feet and the pelvic position. The foot placement basically is what we were working with. For him, that was enough. And that sometimes is how it is. Again, it's a marrying of the person where they're likely to invest time and energy and trying to come up with a really simple, powerful solution for that person in that moment to keep doing what they want to do. And that's a facet joint case study that's quite common. If you've got facet joint issues, you could simply check, is your pelvis rotated? Do I stand with 2 feet pointing forward? Do I have one foot in front of the other? If I switch it and turn my pelvis the other way, is there any measure of relief? Play. What do you got to lose? When you change how you move, what moves changes, pain can really change. That's the mechanical nature of looking at pain. It's one part of it. You won't even play with that stuff if you have a belief that it's not going to work. And for people like that, we need to start there. It's not going to have a major influence if you're also carrying a lot of heavy emotional shit. Changing movement is great. It works for some people who aren't carrying a lot of emotional stuff. That's where you have to start. So again, I emphasize the point. Stubborn back pain is stubborn because there's no recipes. It takes exploration of your beliefs, of your emotional addictions, of your movement habits, of your choices, of who you are. It's quite a mission if you've been in pain for a long time to find your way out. And I see so many people trying, and I guess I see them trying things that I don't think are having much impact. Hence why I'm sharing what I know, my system, my process, 30 years of experience in the game, not just physio studies, many, many other studies that are always ongoing. I'm always learning, but it comes back to simple stuff. And I don't want people to lose hope. I just want them to be open to exploring their pain from many different facets. So if you're taking value in this, like, subscribe, check out my book, From Broken to Bulletproof, Unconventional Ways to Banish Back Pain. They truly are considered unconventional. They are science-based. When we truly understand the pain experience, we understand that the thoughts and the emotions are a huge part of the pain experience. And we need strategies and we need to target them in some people that are ready to go there. Or can be like my farmer mate, ditch all that and just go for the movement assessments and see if they help. It may be where you start, who knows? And then you may be ready to look at those other aspects of self. We all start where we start. Thanks for listening and see you in the next video.